Like a lot of states, we're very troubled, any American should be, that citizens are exposed to perhaps financial ruin for lack of health insurance. It doesn't have to be that way. And I think, honestly, the most imaginative things that have been done in the area have been done by individual states. Some worked well, some didn't, but that's the way the famous laboratories are supposed to operate. Here in Indiana, we've approached it a little differently than some. We raised the tobacco tax to finance the program. Every penny of that went into immunizing children, but then the majority went into providing a new health insurance product. It's distinct in two ways. First of all, it's not an entitlement program. We did not expose our taxpayers to unknown and perhaps unaffordable tab. When we have covered as many people as can be covered with the available funds from the tobacco tax, we'll cut it off. Our estimates are that if you consider the hardcore, low and moderate income uninsured, those who are chronically without insurance, we can get to at least a third of them this way. It doesn't pretend to be a complete solution, but it's a taxpayer-friendly and protective solution. Secondly, most important, it's a consumerist model. The person once qualified pays on a percent of income basis a very modest amount into a personal account, and the system provides the rest. The individual manages that account, and money carries over if not spent. And it's early days, but it does appear that people are doing what I always had confidence they could do. That is, make their own health care decisions, manage their own money. They are secure in the knowledge that if they should run through the entire account through some unfortunate medical events, they are covered and protected just as insurance operates in every other context. Yeah, one feature that I think further distinguishes our system responds to, I think, a legitimate criticism of individual or consumerist accounts, which is that some people might short the preventive care as a way to husband funds. So when we issued the RFP, we insisted that there had to be additional preventive care paid for by the insurer, and it's up to $500 per year. So if you're a member of the Healthy Indiana plan, you'll get a reminder each year of any preventive step that applies to you. It's time for a mammogram. It's time for a prostate exam. It's time for a physical. And that'll be paid for by the program. And if you do go take care of that business, you get even more flexibility over the use of any leftover funds as an incentive.
So the funds, if funds are left over at the end, you can carry that over for other medical expenses? You
can carry over funds that are left over to pay your next year's premium, or they can be saved and they can grow over time. And there's a lot of evidence. We're only a couple years in now, right. But as the base, the universe of people has grown to about 50,000. And there's every evidence of what your common sense would suggest, that don't let anybody tell you that low-income people can't make their own decisions. That's a very condescending and patronizing and inaccurate, I believe, we're demonstrating charge. People are making good choices, and in the aggregate, it appears from all the early data that it is helping hold down health care costs and spending, even while we deal with and promote preventive measures. It would be a terrible setback, and I think it's a terrible idea. I mean, its motivation is transparent. It's a way to pretend it's not costing as much money as it does. If you can cram a third of the cost onto the states, then Washington can preen and posture and tell everybody that their new plan wasn't as expensive as it truly was. That's what the Medicaid expansion is about. And it would have very unfortunate consequences in two ways. First of all, it'd be completely unaffordable for states, most of which are deep in the red now. We happen to be one of the few solvent states left, but this would be unaffordable for us. I can't imagine what it would mean in Michigan, Illinois, California, these places that are flat broke now, to suddenly have to pick up another great big bill. And this trick of it doesn't cost much for the first 3 or 4 years, you know, it's like a balloon payment to a subprime borrower. It's just not.
It's a good way of
It's just not good policy at all. And then the second thing is, depending which form it comes in, at least many of the drafts we've seen would probably wipe out new innovations like our Healthy Indiana plan. And you know, I travel the state on a constant basis, and there are two things that happen everywhere I go. Someone will come up and want to tell me their personal success story. I quit smoking. I lost 100 pounds. I got a 100-pound club by now. You know, remarkable things that people have done to take charge of their own health and what all that means. And the second thing is, someone will come up, it happened 2 or 3 times on last week's trip, often very emotional, and talk about the peace of mind that has come with our Healthy Indiana plan and how simple it is to understand, and how empowered they feel, and how happy they are about that. And I'll be very, very sad if Washington acts in a way that knocks that out from under these folks. I don't think anything they offer to substitute it, certainly not the Medicaid program we know now, will be as effective.
Well, it's almost, from a philosophical and personal responsibility approach, it's totally opposite, because it seems under the proposals in the Senate and the House, you can wait to get sick before you sign up, whereas with your plan, you're encouraged to stay healthy as a way of reducing your own costs and getting a benefit in the future.
Yeah, the healthier you stay, the more money accumulates in your account. And yeah, it is. I must say that I'm very troubled that people's intentions may be good, but what they're trying to do in Washington, I think, takes the most cost-ineffective features of the current system and magnifies them, makes them worse. I mean, we pay people for activity, not for results. We provide no incentive for a consumer to push back or question or make choices or moderate consumption of health care. It feels like somebody else is paying for it. And this weird third-party first dollar model that accidentally grew up in this country, we ought to be trying to move away from that, as we think our plan does, not more deeply into it. So I do hope that better sense will prevail.